Hi, this is Dr. Cliff Gronseth coming to you with another Cliff's Riffs. Today we're going to be talking about advanced treatment for pain. As you know, the body is very hardwired. We're going to focus mainly on the nerve pain today. We've talked a little bit about joint pain, arthritic pain, and things that we typically will do for that, both in the standard conventional treatments such as physical therapy, over-the-counter medications, you have prescription medications, and some of the advanced treatments for arthritis and tendonitis can include platelet-rich plasma, stem cells that we centrifuge out of the body and we inject back into the body to try to initiate some natural healing using Mother Nature's natural regenerative properties. That's typically used for the joints and the tendons like we've talked about in the past. What about the nerve pain? Nerves have a mind of their own. They, of course, are very uh, painful and they have a burning, deep, aching sensation that's sometimes difficult to get on top of. And sometimes there's methods where we use the mind-body connection, trying to train the body to not listen to the nerve pain as much. But there are some fancier things that we can do sometimes to block the pain signal from going up to the brain where you feel it and you react to it. Some of those things include cauterizing the little nerves that go to the joints in your back or in some cases the knee, and we can go after the small sensory fibers in your spine that carry that pain signal out of an arthritic joint up the spinal cord to your brain. Now, we don't zap or ablate or cauterize the nerves that control your muscles. These are purely sensory nerves that give your body the feeling of the joint. People are concerned that if I don't feel it, I might hurt myself more. It does not do that. It's not 100% oftentimes, but there's nobody that's really hurt themselves because they didn't know that they were doing something they shouldn't do. We use it for the spine. We can do the same thing for the sensory nerves around the knee. There are some nerves that control the muscles. We don't touch those. We just go after the nerves that carry the sensation of pain up into your body, try to block those. And we can usually test those nerves by numbing them up with a little bit of anesthetic first before we consider ablating or cauterizing those nerves. What about if you have a burning nerve pain? For example, with diabetic neuropathy or other type of neuropathy, failed back surgery syndrome, those types of conditions are kind of a constant burning, aching pain that can literally just build and build and affect your overall quality of life. There are some newer, fancier techniques that we can do to see if we can block that pain, one of which is called a spinal cord stimulator. And what it does is it allows the body to not pass the pain signal up the spine by putting some electrical wires inside the body and blocking the transmission of the pain from your feet to your brain. So it's almost like putting a blockade across a bridge or something, so you can't cross over. It doesn't pass up through the spine. The wires are very thin. We can put those into the spinal canal, and they lie right on top of the spinal cord, and they can emit a little signal out of the electrodes at the ends of the wires. And so, like I said, that will take this painful area, and the pain signal does not get past that little electrical buzzing, almost like an internal tangent or something, that electrically just neutralizes that pain signal. And the company that makes these special electrodes can dial the sensation up and down the spine based on where the electrodes are placed, and see if they can what they call capture the pain by changing the degree of sensitivity of the electrodes inside the spine. If for the trial, which lasts about a week, is helpful for you for controlling the pain, then you can get a permanent one placed. And it's not this big, it's just a small little module that is placed in the upper part of the back along the spinal cord, and it does the same thing as the wires that we put in during the trial phase. So you have, again, 1 week of trial where the wires are on the spine and on the spinal cord, and then the representative for the company will modulate and try to capture the pain. If that's successful, the wires come out, and then the surgeon will go and place a permanent stimulator in. These stimulators are now MRI compatible. They didn't used to be, but now it does not stop you from getting future MRIs, which was a big deterrent for having the spinal cord stimulators placed. You do need a surgical consultation to see if the surgeon thinks that it would be helpful for you, and if you are interested in having something like this placed. The surgery is very minor as far as back surgeries go, but it does require a consultation with the surgeon to confirm that it's appropriate to even do the trial. If the surgeon thinks that if the trial is worth doing, and if it's successful, then he will likely go ahead and place the electrode stimulator into your back. You also need a psychiatric evaluation as part of the insurance criteria to make sure that you're not crazy. Make sure that you're not amplifying or have other issues that would preclude you from getting the surgery or even the spinal cord trial. They screen for depression and other type of psychiatric problems that may need to be treated before you get the spinal cord stimulator trial. Most people will pass the psychiatric test with flying colors, but it is part of the system. So the nice thing about these advanced treatments is that you get to test drive these fancy pain management treatments by either with the blocks of the spine where we numb up the small little sensory nerves with anesthetic. We do that and we see if your pain goes away. We do the same thing if we're considering ablating or cauterizing the little sensory nerves around your knee. We block those nerves and see if your pain goes away, just as if you went to the dentist with a sore mouth and the dentist would numb up 1 or 2 teeth, and then you say, hey, my pain is gone, and that numbing test drive will confirm that that's likely the source of the pain, and you have a higher probability of success by doing some of these advanced pain treatments. Same goes with the spinal cord stimulator trial. You have the 1 week of the wires along the spine, and over that 1 week trial, you work with the representative from the company. He or she will dial up or down the electrodes depending on what you feel, and if it's to your satisfaction, then we will schedule you or send you to the surgeon for a permanent placement. Well, that's a quick overview of some of the fancier things that you can do for severe pain. Hopefully you don't need that, but they are available. The whole goal is to keep you functional and enjoying your life and enjoying the outdoors. So hope this is helpful for you. If you have any other questions, certainly come on in for a consultation. We can see if it's right for you. And until the next time, live well. We'll see you on the next Dr. Kliss Riffs. Take care.